Hello, my name is Sheila Hardesty, and I've prepared a research proposal presentation for my Integrated Concepts nursing course through Davis and Elkins College. This is my audience. I would like to introduce them to my instructors. This is Crystal and Layla and Brian here beside me. I thank you all for coming this evening, and we're going to talk a little bit about nursing documentation. The title of my proposal is Will Identifying and Reducing Common Barriers to Required Accurate Nursing Documentation Improve the Quality of Patient Care? Through clear, concise documentation, nurses make decisions about their patients' care needs, track changes in their patient's acuity level, and safeguard their patient's continuity of care. As professional nurses, inaccurate charting or omission of necessary details from our documentation can have negative effects on the delivery of patient care. Nurse managers are always on a quest to improve nursing documentation, thus ensuring quality of care and adequate reimbursement while meeting legal requirements. Errors in documentation need decreased through root cause analysis. When it comes to omissions, remember, if it is not documented, it is not done. Deficient documentation processes need studied and improved. Nurses are responsible to review physicians' orders, pharmacy orders, therapists, and other nurses' documentation, and play a vital role in avoiding and correcting any errors. Nursing documentation can communicate and broaden the understanding of human experiences with illness, rehabilitation, disease, and death. I wanted to go over some of the key words or terms I'm going to use in the presentation. Acuity means the measurement of intensity of nursing care needed by a patient. Assessments refers to a head-to-toe observation of a patient's physical and psychological well-being performed and documented by a nurse. Communication, as you all know, is the process of written, typed, or dictated words. And in this presentation, it's the process for exchanging those words between healthcare workers, for the exchange of those words between healthcare workers. A convenience sample, according to Janet Hauser in our textbook, a sample that includes subjects who are conveniently available to the researcher, which is me. That's why I chose a sample of med-surg nurses on the unit I work for my study. A CNA is a certified healthcare employee trained to assist and work under the supervision of a nurse in the delivery of patient care. A central venous catheter is a tube that passes through a vein into the vena cava, which is the large vein returning blood to the heart. Documentation. Documentation is written, typed, or dictated words charted by a nurse. DVT, or deep vein thrombosis, is a blood clot in a vein deep below the skin, most commonly occurring in the legs. ENDIT refers to the Emergency Nurse Documentation Improvement Tool. It is a performance improvement model utilizing computer software in a Level 1 trauma center. It is noted in the journal that this system provides the professional nurse with quick computerized feedback when documentation of a trauma case needs further attention. An environment. Everyone knows what environment means. In this study, though, when I refer to it, environment pertains to the surroundings in which a person lives or exists. Implementation. That's a nursing word. The act of putting interventions, policies, or protocols into place. Intervention. An intervention is an action taken to improve a medical situation. Methodology, a system of methods used in a particular area of study. NHSN, or the National Healthcare Safety Network, is the most used healthcare associated infection tracking system. Omission means to omit or leave out or exclude. Paramedic is a trained healthcare professional whose job is to provide emergency medical care to sick or injured people. A pulmonary embolus, or sometimes referred to as a PE, is a blockage of an artery in the lungs that has traveled through the bloodstream from somewhere else in the body. A protocol is a system of correct procedures to be followed in specific situations. Qualitative research, according to Janet Hauser, is grounded in a belief that reality can never be completely known because it is constructed by the individual. Root cause analysis is a systematic process for identifying the root causes of problems or events and finding ways to reduce or prevent them. Terminology stands for a group of terms used with a particular study, theory, or profession. And the last one is validity. Validity is to be genuine or authentic and believable, focused on accuracy and truth. In most healthcare facilities, errors or omissions in documentation are ongoing. Nurses are responsible to review physician and pharmacy documentation and play a vital role in avoiding or correcting any errors. Patients are entitled to safe, quality care. Poor documentation can lead to medication errors as well as errors in treatment. When a medication is given and not documented, there is a chance it will be given twice, which may or may not cause harm to the patient. When a physician or pharmacy order needs clarification, it is imperative the nurse carries out the process. If the order is not clarified in a timely manner, the patient may receive the wrong medication or the wrong dose, or even miss a dose of antibiotics, anticoagulants, or other important medications. A missed dose is a medication error and or a delay in treatment. An omission of a medication can lead to increased length of illness and amplify severity of sickness or disease. When antibiotics are missed or delayed, the patient may become septic. When anticoagulants are missed or delayed, a patient may develop a pulmonary embolus or a deep vein thrombosis. Omissions in documentation often lead to double dosing, which can be detrimental to the organs of the human body. It is essential for nursing administration to place a constant focus on improving charting to maintain quality control. A patient's assessment must be documented accurately to alert other healthcare workers to any change in the patient's condition. The documentation must be clear and concise. A patient's condition may deteriorate rapidly, with cardiac arrest being the outcome. Accurate documentation can communicate changes in the condition, alerting other healthcare workers to the possibility of impending cardiac arrest. Through clear, concise documentation, doctors, nurses, and other healthcare staff may be able to implement interventions to prevent cardiac arrest or be prepared to quickly initiate a code, possibly saving a life. The study I have planned will identify the most common causes or barriers to accurate nursing documentation. The data will be analyzed to break down these barriers, improve quality of care, and reduce incidence of infection and med errors, which will result in decreased incidence or length of illness and possibly save lives. Errors of documentation often result in harm to our patients, magnifying their sickness or disease process. To ensure quality of patient care delivery, it is the responsibility of the healthcare industry to explore why and how these mistakes occur through ongoing root cause analysis. Analysis for causes of error will be used to improve the documentation process on the Med-Surg unit or OR. Nursing management will develop and implement interventions to reduce barriers to professional documentation. These interventions will enable the Med-Surg nurses to communicate more clearly when charting necessary pertinent information. I'd like to share some of the literature I reviewed for this proposal with you. First, literature section. Through clear, concise documentation, nurses make decisions about their patients' care needs, track their patients' acuity level, and safeguard their patients' continuity of care. As professional nurses, inaccurate charting or omission of necessary details from our documentation can have negative effects on the delivery of quality patient care. Nurse managers are always on a quest to improve documentation, thus ensuring quality of care and adequate reimbursement while meeting legal requirements. It is important for the nurse to record information so that their documentation has meaning and communicates assessments, observations, and any change in the patient's condition. It is necessary to document positive and negative findings, communicating clear facts to all healthcare professionals involved in the patient's plan of care. Communication through documentation will quickly alert others providing care to changes in condition. Nursing Journal emphasizes the use of correct grammar, spelling, terminology, approved abbreviations, and measurable terms to avoid misinterpretations in our documentation. Preventing medication errors is necessary to maintain patient safety. Medication errors often occur secondary to poor documentation, omission of charted meds, and inaccurate notation of transcribed or prescribed orders, as well as violation of the 5 rights of medication administration. The Journal of Clinical Nursing notes that medication errors harm 1.5 million people and kill several thousand each year in the United States, costing the nation at least $3 to $5 billion annually. The journal also notes that a safe drug administration with accurate information is one of the primary responsibilities of healthcare professionals. The process of reviewing and noting physician and pharmacy orders should be taken in significance with a significance placed on accuracy to ensure and maintain patient safety. An improved nursing documentation system was needed at Riverview Medical Center. A system was developed to save the nurses time through introducing the possibility of flawless documentation with voice-activated software programs. In nursing management, it is noted the fact that regulatory agencies visit healthcare organizations to conduct chart reviews and draw conclusions about the quality of patient care and the responsiveness of healthcare providers to establish standards from the documentation recorded by doctors and nurses. You have to excuse me, my throat's dry tonight. I don't know if it's the pollen. We're here in Georgia and the pollen is high. In years past, nurses charted brief notes modeled to a generalized plan of care, documenting their patient's response to illness, disease, treatment, and their environment. Our textbook notes, the advancement of technology in healthcare today requires nurses to chart ongoing data, collecting and sorting what is pertinent and measurable for clear, concise documentation. It is also noted that a medical record containing errors and omissions in documentation jeopardizes adequate reimbursement, clear communication between healthcare providers, and continuity of care, as well as legal requirements. Standard protocols are used by many facilities and organizations. Are standard protocols followed with accurate documentation to prove the care was given? According to pre-hospital emergency care, there are errors of omission in the treatment of pre-hospital chest pain patients, documented or not documented by the paramedics without protocol adherence, which this is serious. Pre-hospital emergency care reported a sample of emergency medical services records were obtained from 4 ambulance companies with written documentation revealing a significant number of patients did not receive care where it was not documented that they did receive care recommended by their protocols. A performance plan must be put in place to improve adherence to protocol and documentation of the delivery of care, as well as increase the number of lives saved in life-threatening situations. Infection control and hospital epidemiology notes that accurate documentation of vascular access in the electronic medical record is standard nursing practice. The National Healthcare Safety Network completed a study to validate a process to measure central venous catheter days from nursing documentation. According to Infection Control and Hospital Epidemiology, error rates were measured using both manual validation and automated validation methods. These measurements allow determination of the error rates consistent with the NHSN methodology, a method in which errors of omission or commission could negate each other. An automated tracking tool to calculate the documentation error rate was used. Infection Control and Hospital Epidemiology also notes the electronic medical record provides a sustainable source of CVC days data without increasing the data collection burden. Feedback from the study was used to develop tools and implement interventions to eliminate errors of documentation of CVCs, which could lead to inaccurate CVC day counts. The journal emphasizes that CVC day counts need to be trusted for accuracy throughout the organization. The implementation of process improvement interventions decreased errors in documentation to a minimal level. And anytime you're talking about catheter access, whether it be peripheral or central venous, it's important to follow protocol and procedure. Your peripheral IV sites, they need to be changed every 3 days to prevent infection. Your tubing needs to be changed every 3 days. And your maintenance fluids that are hanging, they should be changed every 24 hours. If these protocols are not followed, people can end up with serious infections and bacteremia in the blood system. Evolving technology has increased the availability and accessibility of software with documentation tools developed for the improvement of nurse charting techniques. These tools are available for trauma care, med-surg, ICU, and many other fields in nursing and in the healthcare industry. According to the Journal of Trauma Nursing, the Emergency Nurse Documentation Improvement Tool system was implemented as a performance improvement model utilizing its existing computer software in a Level 1 trauma center. The journal also notes that the system provides the professional nurse with quick computerized feedback when documentation of trauma cases need further attention. The qualitative study I have planned will identify the most common causes of barriers to accurate nursing documentation. Interpretive data analysis will be used to break down barriers, thus improving quality of care, resulting in decreased incidence of illness, infection, and death. Sounds serious, doesn't it? Errors of documentation often result in harm to our patients, thus making it necessary for the healthcare industry to explore why these mistakes occur through ongoing root cause analysis. The data from this study identifying the causes of errors in documentation will be analyzed for the implementation of interventions to manage and reduce barriers for completing required accurate documentation, thus protecting our patients from harm through root cause analysis. Data analysis from the narrative questionnaire will also enable administrative nursing staff to develop tools and concepts for the implementation of interventions to reduce barriers in documentation. Our textbook notes, using descriptive evidence from nursing documentation is necessary for the development of appropriate protocols and policies, which need to be followed, right, guys? Improving nursing documentation through evidence-based practice will broaden the understanding of human responses to illness, rehabilitation, disease, and death, thus enabling caregivers to help patients and families manage and cope with issues in these situations. The best participants for the proposed study I plan to conduct are the population of nurses at the local hospital where I work. The sampling frame is the nurses on the med-surg unit. The sample is a convenience sample with characteristics that include major factors important to the research question. According to Janet Hauser, each member of this population has exactly the same chance of being in the sample, with the selection of one subject having no influence on the selection of the other. Therefore, independence is maintained by the participants. I chose to use the method of an email to request the participation from the 50 nurses working on the Med-Surg unit. I will request they complete a questionnaire with hopes of a 100% response rate. The email will explain the importance and significance of the study. The Med-Surg nursing staff will also be made aware that this study is voluntary, quick and easy to complete, with ample time allotted for their participation. The participants will be asked to sign a statement of voluntary participation with the study. The signatures will be removed from the data before analysis to maintain the autonomy of the participants. Frequently reminding the Med-Surg nurses that their feedback will be used for the development of tools and concepts to reduce barriers and improve documentation and communication on our unit will maximize retention during the study. You guys are doing great. We only have a couple left, okay? It's hard to sit still for all this time, isn't it? But just give me a little bit longer of your attention, okay? The best participants for the proposed study I plan to conduct are the population of nurses at the local hospital I work. I'm sorry, I got off track when I talked to the audience there. We'll start now. The nurses will receive the questionnaire in an email. It will be easy to complete in a timely manner. The Med-Surg nurse participants will be expected to complete the narrative questionnaire describing barriers they commonly encounter while focused on charting required accurate, concise data that is measurable without any omissions of pertinent information. And it's hard to do sometimes. To minimize inconvenience and for time management, the nurses will have 60 days to complete the questionnaire. To reduce subject attrition, I will send frequent email reminders to the Med-Surg nurses that their participation in this study will generate data to ultimately improve documentation and communication, as well as job performance on our unit. Some sample questions from the questionnaire. One would be, do you chart everything or just what is required in order to leave work on time at the end of your shift? I know people have responsibilities and they need to get out at the end of their shift and get home or go to pick up children. Excuse me. And as far as supervisors, they don't like overtime. It affects their budget. But sometimes me as a nurse, I know when I have something like a fall happen on my shift or a code and there's extra documentation or just a heavy acuity level, sometimes the documentation, I do not get it done and I end up getting out a little bit late. But the documentation has to be done. It has to be there. Another thing, question might be on the questionnaire, does job performance from your assigned CNA affect your documentation? And I expect the result will be yes. And also job performance of your other coworkers. I will also ask the nurses to describe any other barriers they encounter while charting that aren't mentioned on the narrative questionnaire. And this is a research proposal. If I would conduct the study, I would use the answers from the questionnaire to develop themes as recommended by Janet Hauser. A code book will be established after data collection that would include definitions, abbreviations, and a range of possible numerical values or variables. The data from this study would be summarized by categories or concepts in possibly a bar graph for participation to view and analyze once again in an email, as well as presented in our staff meeting for further root cause analysis. Our nurse managers would use the data from the study and analysis feedback to develop and implement tools and or concepts to reduce barriers in documentation. Improved charting and communication will benefit every nurse on the Med-Surg unit, as well as improve quality of care. Collecting the data in a systematic way will provide feedback to nursing management as well as the Med-Surg nursing staff. According to our textbook, in the field of healthcare, qualitative research can be descriptive or interpretive. Descriptive research establishes basic knowledge of human response to health and illness, whereas interpretive research is a form of analysis that involves extracting meaning from data that requires thought or study on the part of the researcher, which is me. The qualitative study I have planned will be descriptive, with results analyzed in an interpretive way. The results from my qualitative research of my planned study, identifying common barriers in documentation, can be generalized to other nursing units as well as greater populations of nurses in any facility. This descriptive study will be conducted with any convenient sample of nurses anywhere, with results analyzed for quality improvement. Mastering professional documentation requires education, training, and skill. Concise documentation ensures clear communication of changes in the patient's condition, enabling the implementation of necessary interventions in their plan of care, thus protecting the patient's continuity of care. Remember, errors in documentation jeopardize quality of care. Nurses must document professionally and include all pertinent information, using proper language and terminology to promote therapeutic communication. Protocols are evidence-based and made to be followed to confirm appropriate care is given. Quantitative and qualitative research studies which track infection control are essential in preventing or decreasing incidence and spread of infection in the healthcare industry. It is important to document accurately to ensure validity of ongoing research in healthcare. Technological advancements with the development of software programs to improve documentation, when used properly, will assist nurses with communication skills, charting for adequate reimbursement, and meeting legal requirements. These software programs and other tools and templates are developed through qualitative and quantitative research and are evidence-based. Excellence in charting and communication will benefit every nurse on the Med-Surg unit and maximize the quality of care delivered through continuity of care, as well as decrease administrative hours used for quality control. Applying qualitative research or credible data enables our practice to be evidence-based. Identifying and reducing common barriers to required accurate nursing documentation will definitely improve quality of patient care. And I'd like to take a minute and let you all acknowledge my references here that I used to do my research for my proposal. Do I have any questions or comments?
In the Med-Surg, I know the practice that I work in, our physicians one of our physicians uses I think it's Dragon, to dictate all of his patients as soon as they're done. He does all his dictation. Is that something that they are looking, or that you are suggesting that become major everywhere?
Part of nursing documentation.
Right. Because it seems his notes are quite well. And there's very little room for error, because he's spoken everything that needs to be, and he can go in and change it right when it
if
shows
he wants
up.
to change something.
Mm-hmm.
I think a lot of facilities are looking into it. That way, the person can talk as soon as they're done delivering care, and I think it's a software that would promote proper documentation, and because you have to have transcription, but still on a busy shift, it would be much easier to talk into or dictate into a software program and someone else prescribe it. And then, of course, I'm sure when it's typed up or written and printed, then the author would review it and make sure it was what they had wanted to say and communicate and sign off. Yes. And I think it is going to be a big thing in the future of nursing. So I want to thank all of you for coming out tonight. And I thank you two for being so attentive through the presentation. I know it had to be a little bit dry for your age group, but you did a great job. And thank you.